today I am going to discuss about the middle part of Norma Basalis. In my previous video I have discussed about the anterior part of the Norma Basalis. So today I am going to discuss about the middle part of the Norma Basalis. So the middle part of the Norma Basalis extends between an imaginary line drawn through the posterior border of the hard palate and an imaginary line is drawn through the anterior margin of the foramen magnum. So this part is the middle part of the Norma Basalis. So to discuss this middle part of the Norma Basalis, we will discuss it in two parts, the middle area and the lateral area. So let's discuss the median area or the middle area first. So anteriorly, here you can see there are two large apertures. This is the posterior nasal aperture. On either side there is posterior nasal aperture. It is also known as choanine. Okay, this is also known as choanine. And here you can see a bone. This is the posterior border of vomer bone. This posterior border of vomer bone or the vomer bone articulates inferiorly with the horizontal plate of the palatine bone, and when traced superiorly, this vomer bone splits to form ala of vomer. This is the ala of vomer. Okay, ala of vomer. And so this is the vomer bone, the posterior border of the vomer bone, and superiorly it splits to form the ala of vomer. In relation to this is the medial pterygoid plate. This is the medial pterygoid plate, and this is the lateral pterygoid plate. So in relation to the ala of vomer, we have two important canals over here, the palatino-vaginal canal and vomero-vaginal canal. So let's to discuss this palatino-vaginal and vomero-vaginal canal, let's have the orientation of bones first. Here you can see this is the vertical plate of the palatine bone. The vertical plate of the palatine bone, it articulates with the medial pterygoid plate. Okay, this is the medial pterygoid plate and this is the vertical plate of the palatine bone. This vertical plate of palatine bone gives a process towards the sphenoid bone, which is known as a sphenoidal process of palatine bone, and this medial pterygoid plate gives a process which is medially, which is known as vaginal process of medial pterygoid plate. This is the vaginal process of the medial pterygoid plate. So in relation to the sphenoidal process of the palatine bone and the vaginal process of the medial pterygoid plate, there is a canal which is known as palatino-vaginal canal. Palatino-vaginal canal. And this posteriorly, just lateral to the ala of vomer, there is another canal. This ala of vomer overrides the vaginal process of medial pterygoid plate over here, and there is a canal over here. This canal is known as the vomero-vaginal canal. Vomero-vaginal canal. The structure which pass through the palatino-vaginal canal are the pharyngeal branch of pterygopalatine ganglion and a pharyngeal branch of maxillary artery, and through the vomero-vaginal canal we have a pharyngeal branch of pterygopalatine ganglion. Okay, so now this was about the anterior part of the median area of the middle part. This is the middle part. Anteriorly we have these choanae, the posterior nasal aperture and the posterior border of the vomer bone. Posteriorly, here you can see a broad bar of bone in front of the anterior margin of the foramen magnum. Here this is the broad bar of bone. This bone is formed by the fusion or the articulation of the body of the sphenoid bone anteriorly and the basilar part of the occipital bone posteriorly. This joins to form a broad bar of bone here. On this bone, just a little bit anterior to this anterior margin of the foramen magnum, there is a tubercle. This tubercle is known as the pharyngeal tubercle. This tubercle provides attachment to pharyngeal raphe, on which the superior constrictor of the pharynx gets inserted. the superior constrictor of pharynx get inserted over the pharyngeal raphe. Here you can see this is elevation is present, there is elevation present. This is a tubercle which is known as pharyngeal tubercle. On this tubercle there is attachment of pharyngeal raphe, and on the pharyngeal raphe the superior constrictor of pharynx gets attached. Just lateral to this pharyngeal tubercle we have attachment of longus capitis muscle over here. So this is the pharyngeal tubercle, and lateral to it there is attachment of longus capitis, and the anterior part of this bone forms the roof of the nasopharynx, and this area is related to the pharyngeal tonsils. This area is related to the pharyngeal tonsil, and it forms the roof of the nasopharynx. Okay, so this was about the middle area of the middle part of the Norma Basalis.